Hi, I just received an AFib alert on my Apple Watch. This is an Apple Watch Series 4. Now, watch this. Get nice and close, and here is the AFib alert. Can you read that? And I'm going to take it down and say, okay, I got the AFib alert. Now I'm going to launch that little app right there. And can you see what it's doing? It looks like a heart that's kind of moving around. All I'm going to do is press the crown. And look what's happening. That's an EKG. It takes 30 seconds. And I just hold it for 30 seconds. Notice I just had an alert, and it says ECG recording available. I'm going to it, and take a look at there. And these are some history ones, but this is that most current one. So I'm just going to click on it, and there it is. Can you see the graph? I'm going to just move it forward. You can see it's an electrocardiogram. It's a graph, and I'm going to now select right here, export a PDF for your doctor. And just like that, it's finished. And I am now done with it. And I have the EKG or ECG, both of those acronyms work, of the AFib condition. And in fact, if you probably noticed when you were looking at my watch when I just finished, it said AFib condition. Now, I'm scheduled to have a cardio version in a couple of days. Okay, I'm back, and I'm back from a cardio version that happened yesterday. I went into the hospital, they prepped me, and then they basically put those paddles on my chest and zapped me, and it only took one zap. They did an EKG at the hospital immediately following the procedure, and when I awoke, they told me that the heart was beating in a sinus rhythm, which meant the AFib condition was jolted out, and I'm back to a normal rhythm. And indeed, my watch, right there at the hospital, I ran an EKG on my Apple Watch, and well, here are the results. If you take a look closely, we'll zoom in and take a look. You can see in the upper left, it says sinus rhythm, no atrial fibrillation. So, and that was just as I was being discharged from the hospital. And so, happy story. Now, the rest of the story is diet. So I've lost about 30 pounds, almost 30 pounds now, since I started on this plant-based diet. There's all kinds of things, and I'm throwing some pictures and as well as a little video of going shopping or coming back from shopping anyhow. A lot of healthy foods. I'm reading a great deal of information about what is good for you and what's not, and associated with foods that trigger AFib. And so I'm trying to avoid any of the foods that might trigger AFib, some of those of which you'll be very surprised. As you can see in front of me, we just came back from the store, and you see the foods that are not foods that we ever avoided, but now we're eating them plentifully, and it's every single day we eat these kinds of foods. You see a bag of red onions, you see cruciferous, we have to have cruciferous, in this particular case it's red cabbage. Oranges are important, by far one of the most important fruits. It outclasses so many of the others for a lot of good reasons, but oranges are really, really important, as are berries, but we got berries a couple days ago on a different trip. Yams. Yams are incredibly important, very high in antioxidants, and also we have some avocados. And so that's just one, but we do have a variety of fruits, a variety of colorful vegetables every single day. And we're looking forward to maybe having some salmon this weekend, a little bit later in the week. So a side benefit of my weight loss and this diet that I'm on is the reduction of medications. So you see 4 different meds right here. These prescription drugs were all for controlling my blood pressure, which my blood pressure is now considered to be moderately low. Not low, but it's in the right range, but it's on the low end of the right range. And I'm off of all these meds to make that happen just by controlling my diet and losing some weight.